Welcome to Medical Marijuana and Wellness. This is our frequently asked questions series, and today we're going to take on the subject of medical marijuana in an adult use state. Amy Green is joining me.
I'm a registered nurse and I frequently do patient education at Medical Marijuana Treatment Clinics of Florida. And mainly, I help a lot of new patients establish a routine that works for them, along with being comfortable and actually going and making purchases at a dispensary.
Let's talk about why would I ever get a medical marijuana card in an adult use state? We need to contrast the difference between medical and recreational marijuana.
So, medical marijuana is medical products that are derived from the cannabis sativa plant, and they're formulated for the use in treating and or relieving specific symptoms of a chronic condition.
Where when you look at recreational use, really it's formulated to optimize an experience of enjoyment. It's just have a good time, which is fine. In one case, I'm looking for relief, and in one focus, I'm looking for an experience. Why would I consider medical marijuana then in an adult use state? You have personalized treatment when you have a medical marijuana card. You have access to a better quality and higher strength products. There's legal protections. You save on the state tax, and you have reciprocity, potentially have reciprocity in other states.
So my job is to help patients find a dose of the product that is going to give them the relief that they're looking for, but without unwanted or uncomfortable side effects. So it's really finding that therapeutic dose or that sweet spot where they have the relief they're looking for, but without being uncomfortable. Because you can have a low dose that is subtherapeutic. It means they're not getting the relief they're looking for, and it's not really, doing what they want. But then you can go past the therapeutic or the sweet spot and get into the uncomfortable range. That's when patients start experiencing the psychoactive side effects of the cannabis plant. And from a medical perspective, that's actually what we don't want. We want them to have the relief without the unwanted side effects.
More is not better. Really, cannabis is very personalized. People react differently to alcohol and differently to caffeine. The same applies to cannabis. So really, you really should be listening to your body. Your body will tell you when you're getting to that therapeutic dosing level.
What I usually tell patients is, unlike traditional pharmaceuticals where the doctor is going to tell you, you're going to take this pill at this dose for this long, and it's this strength, medical cannabis, it's completely based on how you feel using the products. So it's really about going low, going slow to find that specific dose that works well for you while minimizing negative side effects.
Yeah. Now, the other thing we mentioned is higher strength products and also candidly quality products. This is an example of a certificate of analysis, which every state that has a medical marijuana program requires the products that they use to have a certificate of analysis, because this is important to why you'd want to be a medical marijuana patient.
Yeah, so the certificate of analysis is showing the lab tests that the product has gone through to prove its safety and then exactly what is in the product. So they're testing for any heavy metals, any pesticides that could be left over from the growing and processing, and making sure that you are not exposed to those. In a medical marijuana state, that is required for all products that are sold in medical marijuana dispensaries versus adult use or recreational states. COAs or certificate of analysis is not always required for every product.
This is an example of a COA from a vape pen. So vape pens are going through, especially with medical marijuana programs, highly rigorous testing, both twice in-house and outside their facility to make sure that they're safe.
One of the big protections is medical marijuana sometimes will allow for a higher possession limit to make sure that patients have access to the medication that they need when they need it. So this is versus a recreational program, which might have a lower personal possession limit.
Also, they also give you the capability, medical marijuana programs allow patients under the age of 21.
Absolutely. And this can be really important when you have especially children that might have a chronic condition such as epilepsy, and they need access to medical cannabis to help control their condition. And if a patient is under the age of 21, it's going to be supervised under an approved caregiver. So they're not just going to be using this on their own. They're going to be using it with supervision.
And then in certain cases, if you have a medical marijuana card, it's recognized by other states. Again, it doesn't mean that at a recreational state you can't get medical cannabis to make sure you have the right terpene, the cultivar, to address your particular condition.
Depending on the state, every state that has a recreational and a medical program, they tend to have different tax rates for each. The tax rate for recreational or adult use cannabis is generally quite high. And then the medical tax is either there's no tax or it's significantly lower than the recreational rate.
So, Amy, let's go back and let's summarize. Why would I want a medical marijuana card in adult use state? You mentioned personalized treatment, and really, this is what you do. And I think it's the bulk of a lot of people's issues related to getting in cannabis and using it successfully.
Absolutely. It's about having that person who's a little bit more knowledgeable, giving you that support and answering questions as you go along. And we just want to make sure that they feel that they have the guidance that they need to make decisions that are going to be best for their care.
And I think also having access to better quality products, the legal protection, the state taxes, they break on that, and the reciprocity really makes some sense. And again, I'll point out that cannabis is safer than peanuts. I should point out that you can also follow us on Facebook as well as our YouTube channel to be able to get more information about medical cannabis, and also check out our weekly seminars.
As always, start low, go slow, ask questions if you have questions, really consider using a treatment journal, and just make sure that you're aware of all of your options and just know that you have support.
Medical cannabis can be obtained through a recreational program, but the real key is to get the cannabis that's really tuned to your body, having the terpenes and the flavonoids that are there, as well as the strains that address your particular medical condition. Thank you very much for joining us.